Hello dear students, today we will study about anatomy of nasal septum and its associated deformity that is known as DNS or deviated nasal septum. So let's start. So what is nasal septum? Basically nasal septum is made up of three parts: bony part, cartilaginous and membranous part. Okay, so majority of the septum is formed up of bones and cartilages. So it can be defined as an osteocartilaginous division dividing the complete nasal cavity into two equal halves. Okay, that is nasal septum. So in the bony part, what are the important bones that constitute the septum? That is vomer and perpendicular plate of ethmoid. There are few other bones also, such as nasal spine of frontal bone, maxillary crest and crest of palatine bone. So all these together forms the nasal septum bony part. If you cannot remember all these names, just remember two important bones that is written in capitals also, that is vomer and perpendicular plate of ethmoid. Don't forget these two names. Okay, next is the cartilaginous part. Now the cartilaginous part is made up of septal cartilage, also known as quadrangular cartilage. Third is the membranous part. It is skin lined portion of the nasal septum. It is also known as columella. What are the important blood vessels that supply the nasal septum? It is very important. The names are anterior ethmoidal artery, posterior ethmoidal artery, septal branch of superior labial artery, sphenopalatine artery, also known as artery of epistaxis, and greater palatine artery. What is the venous drainage? There are two important veins that drain the blood from the nasal septum, that is facial vein and sphenopalatine vein. What are the nerve supplies? First is internal branch of anterior ethmoidal nerve, also known as ophthalmic nerve. Other nerves are maxillary nerve and olfactory nerve. So these are the few nerves that supply the nasal septum. Now coming to the deviated nasal septum. So before proceeding to the DNS, this is the diagrammatic representation of normal anatomy of nasal septum. Here we can see the bony part, which is formed by mainly perpendicular plate of ethmoid and vomer. Anteriorly there is septal cartilage and there is small membranous or columnar septum. There are other bones also, such as nasal spine of frontal bone, rostrum of sphenoid, crest of maxilla, crest of palatine bone. So these are the other small contributions in the formation of nasal septum. As we all know that the normal nasal septum divides the nasal cavity into two equal halves, but many a times it is seen that it gets deviated, dividing the nasal cavity into two unequal parts. Okay, so what are the important causes that lead to the deviated nasal septum? Most common cause is trauma, any kind of mechanical force or injury that may lead to the DNS. Also, if there is any kind of injury during the delivery of baby, like such as in prolonged stage of labor, and if there is any instrument used for the molding of head, like we see in forceps delivery or any kind of instrumental delivery is there, this may lead to the DNS also. And there are few developmental conditions such as high arched palate or cleft palate. In that case, DNS will be seen. Many a times it is hereditary and it is seen more in Caucasians. Here in this picture we can see the deviation of nasal septum clearly, as inferior turbinate is visible and slight part of middle turbinate is also visible. So there is clear cut deviation of the nasal septum. Now what are the types of DNS? It can be seen as anterior dislocation or caudal dislocation. It can be of C shape, S shape, and there is another variation, that is septal spur. Basically it is a projection seen at the bony cartilaginous junction made up of cartilage, but later bone intrudes into it. Okay, so that is septal spur. Many a times compensatory hypertrophic turbinates are seen in case of DNS. Why it is there? Because due to DNS there can be more space on one side of nasal cavity, that will lead to the more air flow through that particular nasal cavity as compared to the another part of the nasal cavity. Okay, so whenever there will be more airflow through the nasal cavity, it will lead to the dryness of mucosa. In response to the dryness of mucosa, there will be vasoconstriction, and in response to that vasoconstriction, there will be reflex vasodilatation that will cause the hypertrophy of turbinates. So it is often seen that in case of DNS, whenever there is anterior rhinoscopy done, we see that in the roomy nasal cavity, there will be turbinates which will be more hypertrophied as compared to the normal turbinates. So the basic pathophysiology behind hypertrophic turbinates is this. These are the various types of DNS, that is anterior dislocation, C shape, S shape, and nasal spur impinging on the turbinate. And also there is another variety, that is thickening of nasal septum. Coming to the symptom profile of DNS, patient will complain of nasal obstruction. Many a times it is seen that patient will complain bilateral nasal obstruction. Why there will be bilateral obstruction? As I have just previously explained, that there will be compensatory hypertrophy of inferior turbinate on the roomy side of the nasal cavity. That will lead to the bilateral nasal obstruction. Many a times headache is also seen. Mainly headache is seen in case of septal spur, where the spur impinges on the structures of the lateral wall such as inferior turbinate. Also, there will be nasal bleeding in case of septal spur. Facial pain will be there due to involvement of anterior ethmoidal nerve, and hyposmia will be there. Why hyposmia is present? Because the air fails to reach the olfactory area due to severe deviation of the nasal septum. Many times patient present to us with complaint of mouth breathing also. What are the important signs? So when we examine the patient with deviated nasal septum, first of all we do a test that is known as cold spatula test. In this, we will place a tongue depressor blade just below the opening of the anterior nares or nostrils, we can say, and we will ask the patient to breathe. On breathing, we will observe that there will be decreased fogging or decreased mist formation on the side of DNS. So this is positive cold spatula test. Second is the Cottle's test. In this, on pulling the nasolabial fold, if the patient is able to breathe much better as compared to the normal condition when we are not pulling the nasolabial fold, it means that indicates the blockages at the level of nasal valve area. Okay, so these are the two important tests, cold spatula test and Cottle's test. Cottle's test to identify the blockage at the level of nasal valve area, and cold spatula test for the DNS. What are the other modalities of diagnosis? We can do anterior rhinoscopy also with the help of nasal speculum. In this, we will see what is the side of deviation, is there any discharge present in the nasal cavity, and is there any kind of turbinate hypertrophy present. We can also do a nasal endoscopy, and we can order X-ray nose and paranasal sinuses also to see the condition of sinuses and deviation of nasal septum. In this slide, there are two images. First one is of interpretation of Cottle's test. Second is of cold spatula test. So where open is written, in that case on the patient, Cottle's test is being performed and endoscopy was done simultaneously. Then we will observe that there will be opening of the nasal valve area that leads to the better airflow in this case. While if Cottle test is not being performed, in that case the nasal valve area remains collapsed, that is marked as resting condition. Okay, so it is the interpretation of Cottle's test. In the second image, there is cold spatula test. Uh, Examiner is using blade of tongue depressor just below the nostril, and patient is asked to breathe, and examiner is observing for the mist formation. Okay, so these are the two tests, Cottle's test and cold spatula test. What are the treatment options of the DNS? Generally, it is seen that in most of the cases, there is no treatment required if the DNS is not causing any significant problem or any significant symptom to the patient. In case of symptomatic DNS, first of all, we go for a conservative management, that we give decongestant nasal drops, and in case of associated allergic rhinitis also, we give antihistamine tablets also. And if patient is not relieved by the conservative measures, then we will advise the patient for the surgery. There are mainly two surgeries, one is septoplasty and one is SMR, that is submucous resection. Okay, so basically what are the indications of surgery in case of DNS? So if there is symptomatic nasal obstruction, patient is complaining of persistent nasal obstruction despite of all the medical treatment and therapies, if there is any nasal bleeding, and we will examine the patient, if there is nasal septal spur is present, that becomes the indication for surgery. And also if patient is having recurrent attacks of otitis media or otitis media with effusion and persistent sinusitis, and on anterior rhinoscopy DNS is present, that also becomes the indication for surgery of DNS. Okay, Basically, septoplasty and SMR, that is submucosal resection, are two different surgeries, and we will discuss in a separate video what are the differences between these two. Here, I'm going to tell you there are few named incisions that we give in case of surgeries. Okay, so first is Freer's hemitransfixion incision. It is a very common incision for septal surgeries. It is given along the caudal margin of septum. Okay, the only disadvantage of this particular incision is it cuts through the relatively vascular area. Okay, so it may lead to increased bleeding during the procedure. Second is the Killian's incision. It is given approximately 2 to 3 millimeter posterior to the mucocutaneous junction from floor towards the roof. So basically it relatively cuts through the less vascular area of the nasal septum. So there is reduced chances of intraoperative bleeding during the Killian's incision. So these two are the important named incisions that we use in case of septal surgeries. Now what are the complications of septal surgery? The first one is septal hematoma formation. In case of excessive bleeding, the blood may get collected just below the mucoperichondrium and it may lead to hematoma formation. There can also be septal perforation, any kind of synecdoche or adhesion formation, and if excessive removal of the septum is being done during the surgery, then it may lead to saddle nose also, that is depression of nose from the dorsum. So these are the few important complications of septal surgery. We can see the adhesion or synechia formation between the lateral wall and medial wall of the nose. Uh, there is inferior turbinate and then there is nasal septum, and there is adhesion between these two. So this is the typical nasal synechia formation. So that was all about the anatomy of nasal septum and DNS. Please go through this topic as it is very important topic from exam point of view. Many a times long question or short note can also come in your exams. Follow this channel for more such useful contents. Thank you very much.